The most common issue that people have when they set this exercise or stretch up is that they put the foot too high. If your foot is too high, because the rectus femoris is a two joint muscle, it flexes the hip, but it also extends the knee. So if you put yourself in hip extension and knee flexion, you're going to be stretching the rec fem from both sides, and it's going to be very difficult for you to control this kind of like pelvis under position, right? That pelvis is just going to want to go forwards. So the first order of business is to make sure that the foot is lower than you think it should be, and then from there you're going to put a small foam roller behind your calf or in between your calf and your hamstring, and you're going to give that a little squeeze. If we need to reduce tone in the rectus femoris, we want to pick up tone or increase muscle activation in the abs and in the hamstrings, the muscles that oppose its action on the pelvis. Once you're in this position, you want to make sure that your head, your rib cage, and your pelvis and back knee are all in a straight vertical line. In terms of what you should feel some hamstring as you squeeze that foam roller. You should feel rectus femoris and a little bit of hip flexor stretch, just being in that position. You should feel some abs turning on, especially as you exhale. If you hold on to side ab tension as you re-inhale, a lot of good things are going to happen. And then the last thing on top of that is if you reach your hands forward and you kind of send your chest bone backwards, your rib cage back, you're going to feel a little bit of serratus. And if you need some help feeling this, you can get a band, wrap it around your back so that it's kind of in between your shoulder blade area. And then from there, that actually gives you something to push back against. So as your hands reach forward, you're trying to push backwards into the band and then just breathe in that position and hold on to everything.